If you've been told that you have a herniated disc and now you're scared to bend down or do any movements, I'm going to explain to you what exactly makes a herniated disc worse and will slow down your recovery process. I'm also going to talk about when you typically need to have surgery for this diagnosis, how long it takes for a herniated disc to heal on its own, and if physical therapy actually helps improve symptoms with a herniated disc. Okay, so what causes a disc to get injured or herniate? There are only two main mechanisms of injury of a disc that you need to know about. So the first way, which is what most people think of, is a traumatic event. So typically this is one single event where someone may, for example, be in the gym and they're performing some kind of deadlift or a movement where they're picking up a heavy load, and then they say, oh man, I slipped a disc, and now they have back pain, maybe possibly down the butt, down the leg, but the injury was from one specific event. So that's like a traumatic way that people will injure a disc. The other way is a non-traumatic event, or more chronic and repetitive movement or activity that happened over time. It's a more gradual onset is what we'll say, where maybe they're doing some kind of gardening work where they're bending forward, they're doing a lot of twisting, and maybe they're picking up something light like a pot over and over, but they don't have symptoms initially. But after months or years of performing this bent over or maybe even twisted position, now they start to develop insidious symptoms or symptoms that developed over time, where is a small pain that progressed into greater pain, but it just took a longer period of time. So it wasn't, they couldn't pinpoint the start of the pain to one specific date or event. Is just more chronic in terms of how the injury settled, right? Okay, now that we understand how a disc gets injured, which is either a traumatic event, such as lifting a heavy weight from the ground with poor form, or it's a non-traumatic event, so repetitive, small movements where you're in that position, like bent over or twisted for long periods of time, right? So we understand how it occurs, but to fully understand why it occurs and to actually help you prevent the pain from increasing and to actually allow your recovery to improve, we need to understand two main things. First thing is the anatomy of the disc, as well as what is the function of an intervertebral disc, okay? So let's start with the anatomy. The intervertebral disc is a very simple part of your body. So in the name, intervertebral disc, so essentially that tells you what it is. It's a disc that sits in between two vertebrae of your spine. Now you have them all along your spine, so from your cervical spine or your neck all the way down to your low back. There's discs that sit in between your vertebrae. Now, their main purpose is primarily to provide shock absorption between the bones, between your vertebrae, right? So for example, as we walk, as we jump, as we squat, your disc provides some shock absorption. So when you perform any movements that require some kind of loading or compression, such as doing a squat, or if you're bending down, that disc is going to absorb some of the shock and prevent the bones from making contact with each other, right? So essentially it's going to prevent bone on bone. It's going to prevent any grinding of the bone and, prevent like arthritis. The disc also has another function where it allows you to have certain mobility in different directions, bending, side to side, twisting, that type of thing. But for this video, the main concern or the main purpose of the disc is going to be for absorbing shock. So that's the function of the disc. Now, breaking down the anatomy, there's only two parts that you need to know. So within a disc, there's a circle or a small center that is like a gelatinous fluid-like substance. So that center is responsible for the shock absorption whenever maybe you're doing any kind of like jumping or squatting like we talked about. So that center is going to be responsible for the shock absorption. And then we call that the nucleus pulposus. So that's the first part. And that's just the center, almost like the jelly inside of a donut, right? Now, surrounding that fluid center are rings of like a fibrous connective tissue material, okay? So that outer part is actually just going to contain that fluid center in that middle of the disc. So it just prevents that center from exiting the disc space, right? So then that outer portion, which is comprised of many rings, is called your annular fibrosis. So two parts you only need to know. Center is that gelatinous fluid-like middle, and then the outside are just the connective tissue, that fibrous tissue that keeps that jelly-like substance, that gelatinous-like substance in the middle, okay? Those are the two parts. Now, we understand that the disc, it provides shock absorption, and we understand what the anatomy is. Now, what happens is, as we do movements such as bending forward, you're gonna have the vertebrae in your spine moving along each vertebrae and on top of each disc, right? So if we take that anatomy and relate it back to the mechanisms of injury, which there are two. So first one was the traumatic type of injury, right? So let's say if you're lifting a very heavy weight from the ground, you're going to be bending forward, which that puts a lot of pressure or compression on the front part of the disc, right? And so as you bend forward and you're loading that disc, there is a lot of pressure on the front of the disc. That's assuming you're not keeping a neutral spine. And then the problem is when people, their alignment with their spine deviates from a neutral position, right? Ideally, when you have your core engaged, your spine is straight. Whenever you perform a squat or a deadlift, they always say, make sure your spine is in neutral. But what happens is, especially under heavy load, what can happen is you can lose the form, you can lose that neutral or straight spine, which causes compression on the front of the disc, right? So whenever you have that compression, especially with a heavy load, now the front of the disc is going to be compressed, pushing the fluid-like center of the disc towards the rear or posteriorly, right? So that increases the hydrostatic pressure within the disc, which causes the internal fluid to shoot backwards. And if the load is heavy enough and then the vertebral bodies are pushing down and compressing the front of the disc enough, that can cause the center, that nucleus pulposus, to actually go through the connective tissue and then out of the disc space, which is what we call that disc herniation, right? So that's the traumatic mechanism. Because there's so much compression on the front of the disc, now all that hydrostatic pressure is pushing the center of the disc backwards. And if it's strong enough force or load, then it'll cause the center of the disc to protrude out of the disc space, right? So that's the mechanism for a traumatic event. Now, if you're talking about, we mentioned like gardening, for example, when you're doing a movement over and over, instead, you will have a little bit of that increase in hydrostatic pressure if you're bending forward a lot. But typically what happens is when you're in that bent forward position, now the back part of the disc, so you have different like ligaments and connective tissue that are on the outside and the back part of the disc. When you stay in these positions for long periods of time, and then you do these activities where you're bent forward for months or years, that back part of the disc gets stretched, there becomes more wear and tear, and it starts to lose some of its like elasticity and its integrity, right? Essentially, you're breaking it down slowly over time, and then it starts to lose some of its resilience. And over time, that center, that fluid-like center, starts to make its way towards the backside. And as that backside of the disc wears and tears, what eventually can happen is the center can break through the back and then enter outside of the disc space. And then in terms of whenever you hear people say, oh, I have sciatic symptoms. So when that disc exits the disc space, it can enter spaces that contain neural structures or your nerve roots, such as your sciatic nerve, right? So whenever that center of the disc compresses onto a nerve root, such as the sciatic nerve, that'll cause the symptoms down the hip, down the leg, and even to the feet, right? So those are the two ways that the disc can get herniated and how it occurs. So now you know the mechanisms and you know why it happens. So we know how the injury occurs and also why it happens. So that actually will tell us about what things will actually make the injury worse. Now, we talked a lot more about the posterior or the backside of the disc being injured, but you can also have an anterior or the front of the disc actually get injured as well. So typically what that will look like is more if you're doing extension type of movements, right? And the back side of the disc is compressing, that can cause the center of the disc to shoot forward, right? But typically with the anterior type of bulge or herniation, you usually don't have the same type of nerve symptoms because most of those peripheral or nerve roots, they come out on the posterior side of your low back and travel down the leg. So usually you don't have that same amount of nerve or radicular symptoms with a anterior or front disc bulge. But the main thing is that any part of the disc can bulge. It's just more common that you'll see a posterior or posterior lateral disc bulge or disc injury, right? So with that being said, what actually makes it worse? Now, for most people, there are going to be common movements and positions that they want to avoid to allow the disc to heal properly. So this is going to be specifically anything where you're bending forward at the spine, right? So bending forward causes that anterior compression on the disc. So bending forward, and especially with some kind of rotation or twisting movement, right? So the combination of bending forward and rotating causes a lot more compressive forces on the disc, as well as it really stretches out the posterior lateral side of the disc as you bend forward and you twist, right? So any movements or positions that cause you to bend forward and twist, so you typically want to just focus on, in the short term, working on a neutral spine whenever you're doing any kind of movements, right? And in general, you want to maintain that neutral spine whenever you're doing any lifting, carrying, squatting, right? It just preserves the spine a lot more. But anything that causes your spine to bend forward and twist. So there's a lot of modification where, for example, instead of bending down, we work on squatting down, we work on RDLs, certain movements that allow you to reach or get to a lower position without bending or twisting. So in the short term, it's a lot of retraining and modifying how you do things, but to properly allow the disc to heal and to avoid irritation of the disc, you want to make sure that you're avoiding those aggravating positions. So for most people, probably more than 80% of people, bending forward as with a combination of twisting is going to be the number one thing that you want to avoid. Now, with that being said, some people, if they have like an anterior disc bulge, then typically they want to avoid any extension, anything where you're bending backwards, and especially with some kind of rotation, right? So if you're sitting in the front of a car and you have to reach something behind you, you definitely want to avoid doing that. You actually just want to get out the car and then grab what you need to grab from the back, or just come back to it later. But you want to avoid typically extending and twisting if you have a anterior or front disc bulge, right? But that one is a little bit less common. So most people, you're just avoiding bending forward and twisting. Those are the main things that we have to watch out for. So how long does it actually take for a disc to heal on its own? So typically 6 to 12 weeks is when the pain will start going down. The disc will start healing and reabsorbing back in to the disc itself. Now, this is assuming that you're doing the right things in terms of we're making sure that you're modifying your movements, you're adjusting your activities to where you're not doing those aggravating movements that we talked about, the bending and twisting, those things. So once you kind of modify those things, now 6 weeks is typically when you start to notice that symptoms are improving. Now, some people, depending on the severity of the disc injury, it can take longer than the 12 weeks. Some people it can take 6 months, but every case is going to be a little different. But assuming that you're modifying the things that we talked about, after 6 weeks, there should be some sort of noticeable difference or change with your symptoms, right? Now, some people ask, when do you know that you need surgery? So typically surgery will happen fast if there's a significant difference in terms of your muscle function. So let's say you injure your disc and now not only do you have like nerve symptoms, right? That's sciatica or numbness, tingling, radicular symptoms down the leg, but now there's actually a strength change in one of your limbs, like one of your legs, so left versus right. Typically, if you have a disc injury, it's not going to usually affect both left and right legs. It'll usually be one side. And from my experience, a lot of people end up having their symptoms on their left side, left hip, left leg. So usually it's on one side. Now, if you do have symptoms on that one side, if there's like a strength discrepancy, like a major one between both left and right leg, where now your motor or your muscle function is severely affected, then usually the orthopedic surgeon will want to operate or intervene with surgical intervention quickly, especially if you have in addition some kind of sensory deficit from that disc injury. So having a major sensory deficit change, or that motor or muscle function, like there's a loss of that in combination with the general low back pain that you're going to have where it's more severe. Those are the things that typically qualify someone to have surgery for this type of injury. So for example, when I was younger, I actually had a traumatic injury to my disc where I was deadlifting. This was back in high school, so didn't have the best education in terms of how to properly perform these lifts with loads. So then I had to have surgery pretty immediately because of the sensory and motor changes from the injury, as well as the significant pain. But most people, they won't have that same motor change. So if you have those three things, typically that's when the surgeon will indicate and suggest that's the proper or appropriate intervention versus just doing physical therapy. Now, with physical therapy, a lot of people will ask, does it actually help? So just how we talked about in this video, a lot of the education in terms of what is happening with the disc and how movement affects the injury itself, whether that's movement that makes the disc irritated and causes more pain and symptoms, or whether that's movements that allow you to move in a way where you're not causing more irritation, more pain, and increasing inflammation. Physical therapy will allow you to learn how you're supposed to do daily activities, learn how to exercise and move more appropriately so that the disc can heal on its own. Most people, the disc will reabsorb and the symptoms will decrease significantly and go away when you're doing the right things, the right movements, the right exercise. But you do need to have a skilled clinician take a look at how you're moving, because every disc injury is going to be different from person to person, right? Whether that be how much of the disc is bulged or herniated, or the location. So for example, some people, they'll be more biased with bending towards the left versus the right. Sometimes you'll have one side that's worse, or if you're twisting, sometimes you have one direction which is a little more painful than the other. So making sure that you're getting a good evaluation and assessment of how your body is specifically presenting. So having physical therapy can help determine what movements are going to help you the best and what movements your body doesn't like. You know, your body's going to be the most honest in terms of testing, right? It's going to tell us what exactly is going on and what positions and movements it doesn't want to happen, because then the disc is one of those injuries that it'll be very painful, and because it's such a central part of your body, for example, like your elbow, you can get away, especially if it's like your non-dominant elbow, you can get away without feeling a lot of pain if you just stop using it, right? But with a disc herniation or a disc injury, that is very central to your body, that everything you do, even if I'm trying to reach out with my arm, I have to stabilize my trunk, and there's going to be certain shifting of weight, shifting of pressures with this movement that affects my spine and that disc, right? And then obviously if you talk about walking, standing, everything that you do in the standing position is going to put some kind of pressure on your low back and on the disc, right? So that's why these injuries are very troublesome, and that's why a lot of people are searching up these types of videos, right? Because it's a very painful type of injury. But physical therapy can help your symptoms get better. If you found that video helpful, please subscribe to the channel. And if you do want to see a video of exercises for this type of injury, please leave a comment down below, and I'll see you in the next video.